Here on this model, I want to show you another pair of ligaments which actually are not the ligaments. They are not fulfilling the purpose of a ligament. The ligaments, what's the role of the ligament? It's just a support. So these flaps are not supporting the uterus. They are actually the flaps of connective tissue, so they are known as the ligaments. And because they are very broad, and I have mentioned before, they're wide, so they are known as the broad ligaments. The broad ligament of uterus is present on either side, you know, like the sleeve of a coat. It's been, you know, it's the extension of the pelvic peritoneum, which is covering the top surface and the side walls of the uterus. It's just the double layer foldings of the pelvic peritoneum, the broad ligament. So in this broad ligament, you can see the ovaries are lying in the posterior wall of the, or posterior lamina of the broad ligament, or the, you know, there are two, you know, if the ligament is like this, it's the anterior flap. This one is the anterior flap. This one is the posterior flap, you know, like this. So the ovaries are, and the fallopian tubes are lying behind the posterior flap. Okay, the ovaries are outside the broad ligament. Okay, but there are certain structures which are present in between the two layers or the flaps of the broad ligament. Okay, like the fallopian tubes, the tubes which are connecting the ovaries and the uterine wall. Okay, so this part of the broad ligament shows a thickening. It's known as the mesosalpinx, because salpinx is the tube. It's the tube. Okay, so the portion of the broad ligament which is supporting the uterine tube is known as the mesosalpinx. The part which is covering the ovary is known as the mesovarium. Okay, mesosalpinx, mesovarium. And then there is a part which is running, you know, vertically and covering the side walls of the uterus on both sides. This is known as metrium is the uterus. So mesometrium, the part or the region of the broad ligament which is related to the walls of the uterus is known as mesometrium. Okay, other than these four parts, when I was talking about the contents of the contents of the broad ligament, which are running between the two flaps of the ligament, one is the uterine tube. Obviously, the vessels which are supplying the uterine tubes, like the fallopian tube arteries, uterine arteries, and veins, and also there is you know, the remaining part of the gubernaculum, which is known as the round ligament of ovary, that is also present within the flaps of the broad ligament. Okay, the nerves, you just have to keep in mind that between the two flaps of the broad ligament are running the uterine nerves and vessels. Okay, in the regions of the two flaps of broad ligament, which they get thickened in different spots, and they change their name according to the region they are covering. Mesoovarium, which is covering the ovary, mesosalpinx, which is covering the fallopian tube, mesometrium, which is supporting the walls or covering the walls of the uterus. You know, these are the three parts of the broad ligament. So you just have to understand that the broad ligament is not a proper ligament. It's just the double layer fold of the pelvic peritoneum, which is hanging all around. It's just wrapping around the uterus and giving support to the structures related to the uterus, which include the blood vessels, nerves, and also the fallopian tubes, the ovaries. Okay, so keep in mind. Other than those true ligaments which were providing support to the uterus, the broad ligament is a misnomer, but it's playing a very important role because it's you know, providing a medium through which the vessels and nerves and lymphatics can enter or reach this organ. Okay, so here there is another model which we are holding in front of you, and it's showing a drawing and also our initial model of the uterus, you know, and the pink colored tube is the vagina, which is lying below this pelvic floor. So let me give you an orientation. This is the symphysis pubis, or the anterior part of the bony pelvis. And then this is the back, which is represented by the sacrum and the coccyx. And this is the pelvic inlet. And we are looking at the pelvic floor from above. Okay, here is the anal opening, and these are the anococcygeal raphe and the perineal body. And if you look at this, okay, this I just have mentioned that the anti-flexed position is being maintained by the two ligaments, the two round ligaments. Okay, when we talk about the anti-flexed position, which is the angle between the cervix and the vagina, that has been maintained by a ligament, by a pair of ligaments, which is lying at the back. These are known as the uterosacral ligaments, uterosacral ligaments, right and left. These two bands are pulling the junction between the vagina and the cervix, okay, backward. And this is how they are maintaining this anteversion, you know, the position by you know, when the uterosacral ligaments are pulling the uterus, the junction between the cervix and vagina, backward, and in this way they are maintaining an angle, you know. So if something happens to these uterosacral ligaments, there would be loss of anteversion, okay, and the uterus will be, you know, flipping backward. The other two supports are the transverse cervical ligaments, because this is the region of the cervix, and it's been, you know, supported from sides laterally by the two transverse cervical ligaments, which are also known as the ligaments of Mackenroth, and they are lying in the floor. They are the thickening of the pelvic fascia. Okay, all these ligaments are the thickenings of the pelvic fascia. So the transverse ligaments are running between the lateral wall of the cervix and the wall of the pelvis on each side. The other pair of ligaments is running behind, like between the back of the pubis or the pubic bones and the front of the uterus, the cervix. So you call it the pubocervical ligament. So there are two bands of pubocervical ligaments. And mind you, this is the urethra, which is embedded in the anterior wall of the vagina. You can see this pink structure is the vagina. And always keep in mind that the vagina is lying mostly below, most of the portion of vagina is lying below the floor, level of the pelvic floor. Okay, these are the thickenings of the pelvic floor fascia. The pubocervical ligaments are running between the back of the pubis and the front of the cervix. The two transverse cervical ligaments are the ligaments of Mackenroth, and they are running between the lateral wall of the cervix and the wall of the pelvic cavity. The very important posterior ligaments are the uterosacral ligaments, and they are maintaining the anteversion of the uterus, okay? While the anteflexion is being maintained by the two round ligaments, which are the elements of the inguinal canal in females, okay? So we have to understand this position, and because it is really very important for the uterus to maintain its normal position. Okay, look at this drawing. This is also showing us the relationship between the peritoneal fold, the double layer fold, which is known as the broad ligament, and the uterus and the uterine tubes. Okay, so this purple colored curtain, which is, you know, draping over the entire uterus up till the level of cervix, is the broad ligament. Okay, so look at the relationship. The fallopian or the uterine tubes are one of the contents, the major contents which are present between the two flaps. The anterior lamina which is visible to you, and imagine there is a posterior lamina which is just, you know, towards the wall or towards the board. So this fallopian tube, most part of the fallopian tube is been present within the two folds or the laminae of broad ligament. Okay, but only the ampulla and the that fimbriated end of the fallopian tubes are outside the fold of broad ligament. So they are extraperitoneal. Okay, now look at this. As I've mentioned before, all the blood vessels, including the arteries and veins, which are serving the fallopian tube, the ovaries, and the walls of the uterus and cervix, they are running within these two folds of broad ligament. Okay, so they are also the contents of broad ligament. Here is a structure which is a tubular structure, the ureter. So, okay, so you know that in front of the bladder is the urinary bladder. In front of the uterus is the urinary bladder, and within the urinary bladder, at the back of the bladder, the two ureters are coming and opening, and they are closely related to the uterine artery. So the ureter on each side is present behind the posterior lamina of the broad ligament. So it's not a true content of the broad ligament like the vessels. And in this drawing, certain structures are not visible, but we have to imagine in our mind that the sympathetic and parasympathetic nerve fibers, which are going to supply the musculature and the glands of the uterus, fallopian tube, they will be also included in the list of the contents of broad ligament. Other than those nerves, there would be lymphatics, which are, draining the uterus and the fallopian tubes. They will be also one of the contents. So we know that broad ligament is like a curtain, a double-layered curtain. Certain structures are present within the two layers of this curtain, and certain structures are present outside, either in front or behind. Okay? Here you can see this band, this green colored band, is the transverse cervical ligament of Macedron, which is, supporting the cervix part of the uterus from both sides. And this is the vagina. And, look at the heavy branching pattern of the uterine artery, which is giving off branches to the fallopian tube, all of the uterus, and then the cervical branch, and then the vaginal branch. It's an extensive network of blood vessels, like the branches, which have been given off by the major vessel, which is known as uterine artery. So as we have talked about the supports of the uterus, it is really very important to also talk about the peritoneum, which is reaching the pelvic cavity. So that will be in a better position to understand the relationship between this organ and the peritoneum. This is the symphysis pubis, the sacrum and the coccyx, so anterior and posterior. So if we go anterior towards posterior, the urinary bladder is lying in front between the symphysis pubis and the uterus. Okay, then the uterus itself, and then behind there is a space, and then the rectum, or the lowest part of the hindgut or large intestine. Okay, here this blue colored membrane is representing the pelvic peritoneum, which is the downward continuation of the abdominal peritoneum. Okay, but as we also have mentioned before, that the peritoneum doesn't cover the pelvic organs entirely. It's just partially covering the organs. Okay, so most of the organs are lying behind the peritoneum. They are not lying within the peritoneum cavity, the pelvic organs. Okay, so here you look at it. This is the anterior layer. By the way, it's the double layered membrane descending, and it's partially covering the bladder. So coming from the abdomen, entering the pelvic cavity, the true pelvic cavity, covering the top surface or the fundus or superior surface of the urinary bladder, and then looping and covering the anterior surface of the body up to like here, like body, the junction between the body and the cervix. Okay, anterior surface of the body and fundus of the uterus all the way up, and then goes behind and reaches till the level of the junction between the cervix and vagina. Okay, and then, you know, it just creates a pouch or a blind end, like a cup shaped, and then goes up and covers the anterior and the lateral surfaces of the rectum. Okay, the anal canal is not covered by the peritoneum. Just the lowest part of the rectum is anterolaterally covered by the pelvic peritoneum, and then it reflects and moves up back to the, you know, lumbar region. Okay. Now it has created two pouches. The pouch between the bladder, which is vesicle, and the uterus, vesical uterine pouch. This anterior pouch, which has been collapsed, it's just as having a potential space. There is no fluid, nothing. It's just a potential space, and it's helping friction-free movement of the body of uterus on top of the bladder. Okay, because it's a slippery membrane, serous membrane, the peritoneum. Okay, so vesical uterine pouch, which is collapsed, it's just like a slit between the uterus and the bladder. Then this pouch is wider and more deep. If a female stands up, it's, you know, towards the gravity, this is the deepest part of the pelvic cavity. Okay, this pouch is between the uterus and the rectum, so we call it recto-uterine pouch. The most common name for this recto-uterine pouch is the pouch of Douglas. Okay, this pouch of Douglas is also known as cul-de-sac. It's having the fluid, which is just like a normal peritoneal fluid, that normal quantity. If there is some problem, like if there is a pelvic inflammatory disease, PID, or there is any abscess formation, there would be collection of pus in this region, because this is the most dependent region of the female pelvis, the cul-de-sac or the pouch of Douglas. So there would be the presence on ultrasound examination. A sonologist can find out a collection of dark-colored fluid. It could be a serous fluid. It could be a pyogenic fluid like a pus. It could be blood. So there would be accumulation, which is abnormal. It shouldn't be there. The accumulation is not possible in this pouch because it's usually collapsed. It's been, sandwiched between the body of the uterus and the surface of the bladder. But this pouch is wide and it's dependent, so there would be collection of fluid. A procedure can be performed per vagina, because this is vagina, and by the way, this is the perineal body, and this region, the green colored region, is representing the perineal region, which is lying below the pelvic region. This is the region which is holding the external genitalia in both sexes, the perineal region. Okay, this is the perineal membrane. So a physician or a gynecologist can enter a probe by passing it through a speculum, the vaginal speculum, and reach this point, which is the cul-de-sac, the pouch of Douglas, through the posterior vaginal fornix. This procedure is known as cul-de-synthesis, okay, because it's the cul-de-sac. And what we are doing, we are inserting a needle and take out or aspire out fluid for examination, for microscopic examination, for culture or other reasons. Okay, so this process is known as choledocentesis, draining out of the abnormally accumulated fluid inside the cul-de-sac or pouch of Douglas. Okay, so I want you to appreciate the relationship between the pelvic peritoneum and the uterus and the other organs present inside the true pelvic cavity. Okay, it holds a clinical significance, so it's important to pay attention to this. Okay. So when we talk about the myometrium, we have to keep in mind one very important fact, that these smooth muscle fibers are highly responsive to the circulating female hormones like estrogen, oxytocin. For example, during pregnancy, there is a huge quantity of estrogen hormone circulating within the bloodstream. And these myometrial fibers, they respond to that high levels of estrogen, and they show hypertrophy and hyperplasia, like multiplication, formation of new smooth muscle cells, and elongation of already existent smooth muscle cells will be very much evident during pregnancy. Okay, so the myometrium, before moving on to the innermost layer, I also have to describe that the myometrial region or the layer, the arrangement of smooth muscle fibers is in such a way that there is an outer layer of smooth muscle, then a middle layer, and then an inner layer. Okay, so the outer and inner layers are longitudinal muscle fibers. They are longitudinally arranged smooth muscle fibers, while the middle layer would be circularly arranged. Okay, it's this middle layer which is also known as strata vasculosa, because you remember that I just talked about the uterine arteries on both sides, the way they are entering, they are penetrating through the perimetrium, myometrium, and it's this middle circular layer of myometrium that is having the maximum anastomosis of those branches, the invading branches of the uterine artery. Okay, so inner and outer and inner longitudinal and middle circular bundles of smooth muscle fibers. Okay, then innermost layer, or it's also known as the lining of the uterus. Like any other hollow organ, the lining of uterus is known as mucosa. Okay, so this mucosa lining, it's having an epithelium which is of simple columnar type. Okay, and this layer or lining is known as endometrium, innermost lining. So we have perimetrium, myometrium, and endometrium. This endometrium is playing a very important role during pregnancy, and also, like, if I call it a function, it's been mentioned everywhere that the endometrium is the functional layer of the uterus. Well, we can say that the other two layers are also performing some function, but it's mainly this layer, because it's this layer in which, in case of fertilization, the conceptus will be coming and, embedding. The blastocyst would be embedding itself into the endometrial lining or the mucosal lining of the uterus. Okay? While the myometrium is generally a quiet layer unless and until there are the last stages of labor, or when the labor begins, the myometrium will start contracting under the influence of oxytocin hormone, as just I have mentioned that. Okay. Now we move down. So we just have talked about the layers of the wall of uterus. If we move down, we talk about the cervix, the lowest part of the uterus. It's not exactly like the uterus itself. It's continuation, but its configuration is different. Like, for example, the myometrium, or the middle layer of the cervix, is mainly made out of connective tissue fibers and elastic fibers. Hardly few smooth muscle fibers are there. It's mainly elastic and connective tissue. Okay. Then the inner lining is yes, it is simple columnar type endometrium, but it's not that much well formed like it is in the body and the fundus. Okay. So look at this drawing. The cervix, if you look inside the uterine cavity, this is the body that becomes the isthmus, the narrowest region of the body. And then isthmus terminates at this point. This is known as the internal os. Os means a small, narrow opening. Okay? Here, the body of the uterus is ending, and internal os, downward from internal os, is the cervical canal, because this is the cervix. The cavity of the cervix is known as the endocervical canal or the cervical canal. Okay, cervix as such is in a normal non-pregnant uterus, it's up to 2 to 3 centimeters long portion of the uterus. Again, it's having in its wall, it's having 3 layers: the perimetrium, the myometrium, the endometrium, but their configuration, the histological composition is different, as I just have mentioned. It begins from the internal os and ends at the external os. And remember, I told you that the cervix is actually protruding into the vagina. Okay, so for descriptive purposes, we have divided the cervix into 2 parts: a supravaginal or the uterine part, and an intravaginal part. Okay, so this supravaginal part or the uterine part is also known as the endocervix, and I'll tell you why. And then this vaginal part or intravaginal part is also known as the ectocervix, because we know that the vagina is communicating with the exterior of the body. Okay, so ecto means anything which is in contact with the external environment. Endo, which is in communication with the internal environment of the body. So this is the ectocervix, and this part is the endocervix. Okay, here, if you look at this model, this is vagina, and here is the cervix. And this part, you can see there is a pucker hole. That is known as the external os, or the external opening of the cervix or uterus. There is an internal os which is not visible through vaginal examination, but the external os we can view through pervaginal examination. Okay, so in a nulliparous woman, the shape of the external os would be round, a circular hole, or like a puckered region. Okay, but in a multiparous woman, when she delivered babies, so due to that stretching and overstretching, this external os, if you examine the external os of a multiparous woman, you will be able to see it's placed transversely. Okay, look at this drawing. It's showing us the 2 external osses of 2 different women. This is an external os. When I'm viewing the external os through pervaginal examination, I'm looking at the os, of a nulliparous woman, it's round, puckered, circular. While this one is the external os of a multiparous woman. Okay, so here you can see it's transverse. Because during the pregnancy or during the last stages of labor, there would be stretching of the cervical tissue. Okay, even the entire cervical canal will be effaced, will be gone, because I just have mentioned that there are many elastic fibers present in this, cervical part of the uterus. So there will be no cervix in the last stages of labor. And there would be, the birth canal would be having like the lower part of the uterus and then vagina. Okay, so due to that much overstretching multiple times, the external os acquires a shape of transverse, like, a transverse slit. That you should be able to identify on clinical examination. Okay. Now, the other thing I want to mention when we are discussing the cervix, as I've said, that the endocervix is the part of the cervix which is in continuation of the uterus, the uterine canal. The lining epithelium of the endocervix is simple columnar type, just like the lining epithelium of the uterus. While the lining epithelium of the ectocervix, which is visible through the vagina, it's protruding into the vagina. This lining epithelium of this ectocervix is stratified squamous type, which is similar of the vaginal epithelium. So what happens, that initially at the time of birth, the entire epithelium of, the epithelium of the entire cervix, both endo and ecto, was simple columnar type. But at the time of puberty, as we know that the vagina is highly acidic, just keep this fact in mind. At the time of puberty, the epithelium, the simple columnar epithelium that extends down to the ectocervix, it's like just a simple columnar. But later on, due to exposure to the acidic pH of the vagina, this highly sensitive epithelium transforms into the stratified squamous type of epithelium. You call it the squamous metaplasia, the adaptation. Because the environment here in the vagina is highly acidic. So the simple columnar epithelium cannot take this acidity. So it transforms, it goes through a metaplasia, change in the shape, change in the appearance of the cells. So it becomes the stratified squamous type of epithelium, which is very good for hard, like wear and tear. This metaplasia leads to a clear transformation zone. So in the ectocervix, there is a transformation zone, and it holds a very important clinical significance. This zone is the most common site of squamous cell carcinoma of cervix. So carcinoma in situ is mostly present in this transformation zone. There would be initial epithelial changes, and then eventually that metaplasia, in some cases, like as a result of exposure to herpes virus, a female can suffer from that metaplastic zone, can suffer from neoplasia. This carcinoma in situ of cervix is highly responsive to treatment. It's curable, but if it just expands, it just metastasizes and invades the inner linings, then it's really very dangerous. Okay, so the last component of the female reproductive tract is the vagina, and it's a hollow fibromuscular tube of up to 6 to 8 centimeters long. Okay, I would say it's the longest part of the female reproductive system or tract. And it acts like the birth canal at the time of parturition. Also, it allows the passage of the menstrual flow out of the body, from the uterus out of the body during each menstrual cycle. And it's the organ of copulation as well. Normally, I have this model in front of you. So normally it's collapsed. Okay? How? That the anterior and the posterior walls are approximating each other. They are in contact with each other, just like the uterus and the cervix. Okay? Except for one region, which is the topmost region of the vagina, and it's related to the cervix. Because here is the uterus, the model of the uterus, and this region is the cervix. And remember that the cervix is protruding into the substance of the vagina. Okay? So this region, which is encircling the cervix, that is expanded. It shows the cavity. Okay? The rest of the vagina is normally collapsed. The walls, anterior and posterior walls, facing each other. Okay? This region, which is the region which is encircling the cervix, is known as, this region is like if I give you the example, like fingers, you know, it's known as, the region is known as vaginal fornices. These are, when the cervix is protruding, the vaginal tissue or the tube is trying to encircle the cervix from all directions. Okay? So there is an anterior fornix. Okay? There are two lateral fornices. And then there is a large posterior fornix. Okay? Like this. So these fornices, they are normally expanded, okay? And they are trying to cover the cervix from all directions. The anterior fornix is related to the shallow vesicouterine pouch. Remember that the bladder is lying in front of the uterus. So there is a, peritoneal pouch, the vesicouterine pouch. So the anterior fornix is related to that pouch, and through that pouch it is also related to the bladder. So if I insert my finger and explore the top part of vagina, which is close to the cervix, through the anterior fornix I would be able to palpate the bladder, basically the base of the bladder.